Good. You guys ready? Okay. Good afternoon, and thank you for attending today's press conference on an important topic that is affecting many lives. Present on stage is Sheriff Demings, Dr. Rawls, Orange County Director of Public Safety, Division Chief Vida from the Orange County Fire Rescue, Mr. Raskin, Vice President of Crisis and Substance Abuse Services for Aspire Health, and Mr. Seckinger, a parent of a victim. I will this time turn it over to Sheriff Demings.
Thank you, Captain Torres, and thank you to all of you for being here. We are here this afternoon to really sound an alarm in our community. You have heard recent past, and that is the current crisis state that we're in as a community and dealing with individuals who are addicted to opiates. Sadly, we have to say that many lives are being lost almost daily now, and what we're trying to do is to stop it, to change the trend. And so today we're going to share with you some information about what we have been doing to turn around the trend in our community, but also provide some information to the viewing audience about resources that's available in this community. This is not a problem that law enforcement can really arrest its way out of. It is going to require some prevention in our community, some intervention, and then some law enforcement and prosecution to make this overall effort work. So what I'm going to do is share with you some statistics. Again, people are dying here in Orange County. We are here today to sound the alarm and put a face on the crisis that we're dealing with. To give you an idea of just how serious the problem is in our county, I want you to consider some numbers. During the first 6 weeks of 2017, last year, we had 102 overdoses countywide. In the first 6 weeks of 2018, this year, there were 172 overdoses, which represents an increase of 68% during the same relative period of time last year. February has not ended, and we've currently had over 207,000 overdose cases, 207 overdose cases this year. Now I'm going to talk a little bit about the overdose deaths. During the first 6 weeks of 2017, there were 10 overdose deaths. That's a year ago, 10 overdose deaths within the first 6 weeks. In the first 6 weeks of this year, 2018, we've had 16 overdose deaths, which is an increase of 60% in the number of people who are dying as a result of overdoses. Think about that, a 60% increase. We have to do something as a community to address this disturbing trend. Had it not been for the deployment of Narcan by law enforcement agencies and first responders in this community, we certainly will be looking at significantly more deaths. Since the beginning of the year, the Orange County Sheriff's Office alone has had 20 different instances in which Narcan was administered. That's 9 in the month of January and 11 so far in February, and the pace seems to be increasing with 7 days yet to go in this month alone. We've had 10 cases where the same person was repeatedly overdosed. Those 10 people are responsible for 21 of the 207 cases this year. So roughly 10% of the cases have been involved with individuals who have repeatedly overdosed. Look at the photographs that we have here. Those photographs really kind of tell the story of men who lost their lives to overdoses. This is a serious issue, again, that we all have to work together to resolve. We're putting a personal face on it. These are individuals, loved ones, husbands, wives, daughters, sons, etc., who are dying in our community. The true expert on this is with us today, someone that I work with quite a bit, Ms. Carol Burkett, the director of Orange County's Drug Free Coalition. I'm going to ask Carol to come forward and to share with you a different perspective, or her perspective on the crisis that we are currently facing. Again, Ms. Carol Burkett.
Thank you, Sheriff. On behalf of Mayor Jacobs, she could not be here today, but I just wanted to say that this is an issue she is very passionate about, certainly passionate about the work of the Orange County Heroin Task Force, that Sheriff Demings co-chaired that effort, and the work that's going on in our community. As the Sheriff said, we're in a public health crisis, and a bit of good news is what was recently accepted and awarded by the Mayor and County Commission yesterday as a SAMHSA First Responder Comprehensive Addiction Recovery Act grant. This is a $2 million grant that I think will go a long way in the fight in opioid abuse in our community. We were one of 21 communities across the nation to receive this, and the only recipient in Florida. And I think that speaks to the work and the collaboration of the Orange County Heroin Task Force as we continue to address this public health crisis. To tell you just a little bit of what this grant will do, over the next 4 years, we're going to train and equip law enforcement with naloxone, and for those agencies that already have deployment of naloxone, being able to give them additional doses so they can respond with this life-saving medication and continue to save lives. It also enhances patients' ability to get treatment. We're funding a position at Florida Hospital East and Orlando Health Downtown, our two busiest emergency departments where we see heroin-related arrests. So having a position where they can be able to talk with that person that's come in for a suspected opioid overdose and navigate their way into treatment is critical. And then lastly, this will fund an epidemiologist and an evaluator through our health department, because we want to make sure that we are watching those trends and that our strategies that we're implementing are having the effective outcome that we want in the community. Last week, though, as the sheriff mentioned, the number of overdoses in response in January in a concentrated area of the community, we, based on the sheriff, at the request of the sheriff and the mayor, deployed some community outreach initiatives. We scheduled emergency educational sessions, and that was with Aspire Health Partners that are here today, and we want to thank them for their work. They held educational sessions last week, Tuesday and Thursday, at Orange County Holden Heights Community Center. And they were able to provide 25 residents and family members with valuable information about the opioid epidemic, about treatment resources. They were able to walk away with training and access to naloxone that you need to have just in case if you know someone who is addicted and could overdose. And they were also there to answer questions and provide guidance getting into treatment and on that path to recovery. We're thrilled with those sessions, and we want to continue those, certainly in this affected area and throughout the community. And as I leave you with one statement, and it's here on the board, every day 115 people in this nation are losing their lives to this opioid crisis. And we want people to know that treatment does work, recovery is possible, and we want them to get that information so they can help their loved ones to that path of recovery. And they also know how to respond to an overdose. And we have information on the Orange County Heroin Task Force, the webpage they launched, OCFL-HeroesAgainstHeroin.org, where family members, friends, loved ones can find that information and access those resources. And importantly, to dial 211. That's United Way's information and helpline, and that is an easy number to remember where you can gain access to those treatment services. I'd like to now turn it back over to Sheriff Demings.
Okay, again, as you've heard, treatment is certainly part of our overall strategy to reduce the numbers in this community, and so we do appreciate the work of Aspire Health and being a partner. The area in which we focused in a week or so ago was primarily done because, as we see it, that's somewhat the epicenter of where we're seeing the greatest number of cases in Orange County. That's the South Orange Blossom Trail, Holden area. But we're seeing cases or incidents occurring countywide, almost in every sector area of our county. At this point, I'm going to ask Orange County Fire Rescue Division Chief Michael Oveda to come, and he will share with you the response, some of the rescue efforts that we're seeing from our EMS personnel. Again, Orange County Fire Rescue Division Chief Michael Oveda.
Thank you, Sheriff. Orange County Fire Rescue has been honored to support Orange County Sheriff Demings and Orange County Mayor Teresa Jacobs' emergency preventative measures in Orange County. In our community, where overdoses have been on the rise, the opioid epidemic affects families, neighbors, and friends, and it affects those of us who respond to them in their greatest time of need. For Orange County Fire Rescue, we, like the Sheriff's Office, have seen firsthand the devastation that the opioid public health crisis has created. In fact, in 2017, we responded to almost 2,500 calls for suspected overdoses. So we came together with our partners on February 15th for a door-to-door campaign in the Holden Heights area. We amassed 38 teams of 130 fire rescue personnel with the goal of providing emergency response information and community life-saving information resources for families of people who may be addicted to opioids. Within the course of one business day, we distributed information to over 7,000 residents in the Holden Heights area on how to respond to opiate overdose and how individuals can access treatment and counseling. At Orange County Fire Rescue, we train, we respond, and we prevent crisis wherever possible. Everything we do is focused on serving our community in their greatest time of need. Sheriff, it's been an absolute privilege to be a part of working with all of our partners here today, and Orange County Fire Rescue stands ready to serve in any capacity needed to save lives. Thank you.
Okay, again, what we're trying to do today is put a face on the problem that we're having. We have a parent who is here, Mr. George Seckinger, who was brave enough to come forward and talk about the pain of opioids in his family and how it has affected the life of one of his loved ones and how it took away, sadly, the life of his daughter. But before Mr. Seckinger comes forward, we're going to show you a brief video clip that is posted on our Facebook page for the Orange County Sheriff's Office, and it essentially talks about the struggle that his daughter had with heroin and how it ultimately took her life. And so let's take a look at the video, and from there you will hear from Mr. Seckinger himself. Okay, again, as a parent, as a family member, perhaps some of you have lost a loved one to this terrible disease, if you will, that we're dealing with in terms of addiction, or perhaps you know someone that lost their life or that they are currently addicted. And so without further ado, I'm going to ask Mr. Seckinger to come forward, and we certainly honor his daughter in this way, and we're certainly sorry, Mr. Seckinger, for the loss that your family has experienced. And so would you come forward at this time?
Thank you, Sheriff. I appreciate this opportunity very much. As was mentioned by the sheriff, we're truly at an epidemic level all over the country. It's not only here in Orlando. I saw my daughter go downhill. She'd probably been on drugs, not to my knowledge, but probably back at least 4 years. I saw her go downhill in the last year, from a superb athlete to a very thin, sickly-looking child. When I was in the hospital, I got notification one night at 8 o'clock that my daughter had been found dead here in Orange County in a hotel room. I was frankly shocked. She was in rehab. She had been Marksman Act voluntarily and sentenced to 6 months rehab. She'd been in there dry for about 7 weeks. I talked to her the night that she left the facility. I'm not quite sure why she left. I talked to her about 3 hours before and thought everything was fine. She had a 4-hour pass to come to the home, to my home, after I got out of the hospital and visit the following Thursday. She died on Monday morning of that same week. It's all around us. And you look at yourself, I've raised her since she was 10, a single father. And I don't know what I could have done different. Once she became an adult, she chose her own route, her own friends, and unfortunately some of those friends were not good. And there was death all around her from overdose. As the sheriff talked about, yes, my daughter Jennifer was a multiple ODer. She's been in and out of the hospital, ORMC, Altamont Springs, the emergency rooms. She kept on trying it. She was dry for the 7 weeks, and the only conclusion I can draw that when she left, for some reason, she had to try it again. And since she had been dry, the doses she was used to, the system could not handle it. Whether there were any additives to it, I don't know at this time until the toxicity report is out. It could happen to any of us. I looked at it. I went to bought a home when I moved here from Atlanta in the best school district, I thought. Very careful about choose the correct schools, but it didn't matter. It still happened, and so many of the people, at least 4 people I know around her, also have died from OD. It's hard to believe, but it's true. And the additives, when you start adding other chemicals to it, you've increased the dose rate at least 100-fold. The body can't take it. That's about all I can say. She was 25 and a half. I might add she was a UCF senior with 2 courses remaining in healthcare administration. She had a clean record as far as police-wise. She had a clean record. You say it, how can this happen? I keep asking myself, what could I do different? And I cannot answer that. There's no really good, viable solution. You can move to another location, you're going to run into probably the same thing. Try to get her away from friends are bad, they're going to come back. She's an adult. She's going to make her own decision. I appreciate this opportunity. Thank you.
You heard it from a family member, a father. We don't want another parent or family member to have to experience what Mr. Seckinger's family has experienced. When we look at the magnitude of this problem that we have here as a community, we're trying to address it in healthy ways and trying to get people into treatment and also trying to stop people from using. What we're seeing on the streets of Orange County is not unique to here. We see it in other places in the country. When you buy drugs off the streets, you never know what it is that you're really purchasing. In many cases, these individuals believe that they are purchasing heroin, and it's turning out to be something different. It may be fentanyl, which could be 100 times or more potent than heroin. In some cases, the fentanyl may even be even more potent. And as Mr. Seckinger indicated, Sometimes when you're a user and you're used to using a certain dosage amount that might be heroin and it's fentanyl, that may prove to be a lethal dosage for the individual. But it's so alluring to these individuals, they overdose and they overdose again. They nearly overdose, and EMS personnel really only has, on average, about 4 minutes to get to one of these individuals who may end up in respiratory failure before it may be irreversible. So that is why, as a community, we, in the first response community, are carrying naloxone or Narcan on deputy sheriffs and paramedics, and it is saving lives. But we don't want to just save lives. We also want to stop people from using. So this is an appeal to the people in this community. What I'm saying to them is, don't play Russian roulette with your life by shooting something into your veins that you really have no idea what it is. The street dealers are not using pharmacology with a precise dosage. They are simply just experimenting, and they're experimenting with your life if you use and buy the type of dope that is being peddled on our streets. At this time, what we will do is take a few questions from the media here. Any of our subject matter experts can respond. Again, we have Dr. Rawls here, a medical doctor, the public safety director for the county, and also the medical director that oversees paramedics and EMS personnel who respond to these types of calls for service. He certainly can respond. We have representatives here from Aspire Health who can talk to you about their services, and then you have law enforcement here that can answer questions as well. So we'll throw it open to you at this time.
Sheriff, what's the next steps? I mean, you know, we're talking about a community action, trying to get the community as a whole to actively try to stop people from using. But from a law enforcement standpoint, do we increase arrests? Do we put more officers out there with naloxone? What is the next step?
We are doing law enforcement. I mean, we're on a daily basis. We have undercover agents who are responding to calls for service. Whenever a person goes into respiratory failure and they overdose, we are choosing to respond to that scene because we are there to investigate and work backwards to try to hold the dealer accountable. In many communities around our nation, this is treated purely as a medical emergency, and law enforcement is not responding to those calls, but we respond here. So we want to hold accountable those who are drug dealers. We're working with our federal and state law enforcement partners to stop the supply. Much of what we're seeing coming into this community is coming in from our southern borders. Some of it is coming in, and when we talk about fentanyl, for example, it's coming through the Postal Service. And so we are forging partnerships with the Postal Inspector's Office to increase our interdiction of mail that is being sent with fentanyl. A lot of it that we're seeing is derived from China and places like that. So the only way we can address that, we have to work with our federal partners. But we're also going on an awareness campaign, and we're in our schools, we're in our neighborhoods, we're talking to you, the media, to, again, put a focus on this. And then our treatment partners are working as well to deal with people who are already using to change that. Even from our jail system, we in the Orange County Jail, we're one of the few jails around the state where an individual who is an opioid abuser, if they voluntarily want to participate in a program, they're given Vivitrol when they leave, which is an inhibitor, to stop them from, if they did use, from being able to get high from the usage. And so we're doing all of those extraordinary things. We have our heroin overdose task force that Mayor Jacobs and I co-chair, and so we're going to continue to work this effort. We saw a decline from when we first started the heroin task force, and things were stabilized. But in recent weeks or months, we are seeing the numbers begin to skyrocket.
How do you get help to people who either don't want help or can't admit they need it?
Okay, I'm going to kind of get some of our other partners involved, and I'm going to ask a representative from Aspire Health to come forward to kind of talk to you about the cycle of addiction and how you try to get people into treatment who may not want it or readily see treatment as an option.
Thank you, Chief. That's a good question, and that's a big part of what we're here for today and what we've been doing recently, going out into the community with outreach, is getting as much knowledge and understanding as to what addiction is and how you can get somebody into treatment. It really does require those in the community to understand how to assist, and the number one thing that people can do is understand how to get the individual to us. And so that would be knowing the phone numbers, knowing where to call, when to call, all of those things. And so we have clinics that are geared specifically at addressing addiction, and we are readily available to provide that information here today to you, and then also in community outreach throughout the community.
Let's say I have a family member that
Sure.
has an addiction, doesn't want to admit it, doesn't think they need it, just thinks, oh, I can kick it. I don't have. I'm not a user. I'm just a casual. Then how do we get those people to get the help they need? And when the people themselves won't admit it.
Yeah, and that's an issue with addiction in general. And I don't know that I have an easy answer to that. Really, it's getting people to understand what's available to them so that when that person does get to the point that they're willing to go, you know what to do. Because forcing them into treatment isn't really possible. But knowing where to go when they're ready to go is possible. And so that's what we're trying to do.
I mean, there's got to be.
Sure.
We heard George's heartbreaking story.
Right.
On the way here, we stopped on the Orange Blossom Trail. We met a man named Justin, a confessed heroin addict, who says he's been battling this 18 years.
Right.
And
So.
we hear a lot of very heartbreaking stories, but are there success stories?
Absolutely. There are many success stories. Those success stories don't usually simply go from the beginning to the end with no bumps. And so people do struggle in treatment. Sometimes they take 2 steps forward and then a step back, and then we have to keep going forward. But we know that medication-assisted treatment works, and that is something that we provide at Aspire. And that is where you provide some type of medication that helps with the addiction process. I know that Chief Demings mentioned Vivitrol. That's something that we have at Aspire as a program. We also have methadone and we have buprenorphine that are also effective. Those are evidence-based practices, and we have many cases where it does work, but we need people to get into treatment. And so when we get somebody into treatment, engage them, it works very well. And then, of course, Narcan saves lives. So if we get that out to the community so that others have it, not just law enforcement or those in responding to emergencies, but when the community has that and a loved one is near the person that overdoses, they're able to administer that and save their life.
Does it help that your funding's been cut by the state?
No, it does not. And that's a good question, although we do have funding. And it is important to note that with the opioid epidemic, if you do get into services with us, if you're underinsured or uninsured, we can provide services to you, and it's highly likely that that will have you incurring very little to no cost. So it's available to people, but it does make it is complex because sometimes along with this comes mental health issues and other services are needed, which that can be a struggle at times. But I would suggest getting somebody connected with us, and we can go from there.
Well, how does it not help?
I'm sorry?
How does getting your funding cut not help?
How does it not help? Well, sometimes we have Sure. We have mental health services specifically sometimes that are needed, and we had beds cut in our mental health units. And therefore, sometimes when mental health is the primary issue, which sometimes is the case with substance abuse, that has negatively affected our ability to help. But we are still able to help. And so it is complex. It's not always cut and dry, but certainly getting people connected with us and really, again, it's recently in some of the outreach events that we've done, many of the individuals out there don't know how to begin, who to call, and where to call. And so I know that the county has indicated that 211 is a resource for calling to find out how to get into services, but you can also call us directly. And so I can provide that information today to you.
I have a question about, you said that with the heroin task force, there was a significant drop in Orange County for heroin-related deaths. And I remember speaking with you just a couple of months ago about the FDLE report and how this work from the county has kind of reduced those numbers, and now you're saying there's kind of been a spike in recent weeks. What do you attribute that to? What do you think, what has been kind of the difference from last year?
I believe that the lethality of what we're seeing is related to the trend of the drugs that we're seeing coming into the country from other places and the potency associated with those drugs. I think that we see some social changes occurring here in which individuals are chasing euphoria. People like to get high, and unfortunately, sometimes when they get high, they do so by consuming something that really is going to cause them a overall health problem. And so we're just trying to catch up with this. This is a problem that really started out in the northeastern U.S. and it has now migrated down the East Coast, and it's here in Florida, and it's here with a vengeance. This problem is, again, throughout Florida and other states as well. What we're trying to do is try to get in front of it if we can, to try to slow down the upward path of the numbers that we're seeing. So this is part of our strategy to do that, is to come to you, to ask you all to assist us in sharing this information and putting it out. We are seeing this on our streets today. So when you ask the question, why are we doing a press conference? It is because we're seeing people dying today. And so there's a certain sense of urgency associated with this to warn. We have this duty to warn people that we're seeing some bad stuff that's on our streets today. We have this duty to also give people information about where they can get treatment, where they can get help. And then we have this responsibility to do our job as law enforcement officers. And we're going to continue to do that. Again, if we only used one prong of this equation, and that was just arrest, we will have miserable failure as a result of it. And so what we're doing is reaching out to all of these stakeholders in our community, saying this is a community issue. It's not a law enforcement problem. This is a community challenge that we have.
What kind of support do you wish you had from state officials and even at the federal level in Orange County to battle this crisis? Do you have that? Does the county feel that support? Is there anything that you feel?
Well, again, it's a nationwide problem, and you heard Ms. Burkett talk about the $2 million grant that really is a federal grant. They are recognizing this problem. We had to make application, and Orange County was fortunate in getting the grant because we were able to tell our story with factual information to justify the resources coming in. At the state level, currently our state legislature is in session. The governor is very well aware of the challenges that we have as a state. I am hopeful that we will see additional funding dedicated in our state to treatment. We, as Florida, has ranked at essentially at flat last, the bottom in terms of treatment for substance abuse and mental health treatment. And that has to change if we're going to adequately respond to this crisis.
You mentioned that there were 20 different instances in which the deputies have deployed Narcan. In how many of those instances were lives saved, or what percentage?
I'll get you the numbers of the number of what we call saves of individuals that that respiratory failure was reversed and they were transported to the hospital. We don't just let them go in the streets once we administer it. You know, we're going to call EMS personnel, and that person is going to be transported to a hospital for additional treatment services. But you heard me share in the very beginning the numbers about those who repeat. It's probably more prevalent that once you have overdosed, you're more likely to overdose again. If you simply use the same amount, you're more than likely going to eventually overdose again if you don't stop using. So that's a question. I know Dr. Rawls is here. He could probably talk to you a little bit about that, Dr. Rawls, if you don't mind, kind of addressing that issue.
Sure. In reference to how often is Narcan deployed and it saves a life, I will tell you that in any scenario where the person is actually still alive, Narcan is extraordinarily effective in reversing the overdose. The scenarios where it wouldn't work is where the overdose has already sort of run its course and the person has died. They get a dose of Narcan intranasally that is 5 times the sort of effective reversal dose in some cases. And there's a window there because of the type of analogs of the opiates that we're seeing on the street. But the idea of the dose that we're using is it's a very high dose, very effective, and very likely to save the life of the person that has any chance of living. And we know, and I can tell you firsthand, because I do spend some time in the ERs on nights and weekends, Orange County Sheriff's Office has brought us people who would not be alive had they not been given that Narcan before EMS arrived. Because as the sheriff mentioned, there are literally a matter of minutes. We're talking 3 to 4 minutes before the brain damage is irreversible and the body expires. So the law enforcement deployment of Narcan has been extremely effective in saving lives. When somebody overdoses and lives, that's an opportunity to have a conversation with them, whether that's a family member, whether that's in self-reflection, whether that's a hospital-based navigator, and the entire sort of idea of saving their lives. I know there's some question about, well, is it effective if people keep overdosing? Every time somebody has an opportunity to rethink what's happening in their life is an opportunity to make a change, and that's really what we're after.
George, can I ask you a final question?
Sure.
Yeah.
Mr. Secretary? You know, sorry. I think Mr. Secretary. Right? Is that who you
I'm limping because I had surgery. Any questions, please almost yell at me. I'm an old artilleryman, infantryman, and my hearing is not that good, so I'll try to address anything you might want to know.
My question, George, I'm over here. What is your message? What is your message?
I think my message would be everybody recognizes it's an epidemic. We've got to fund it, and it's not from the county. We need federal funding. That's my message. The resources are not, it's so much of it, I honestly believe it's overwhelming to police departments, medical facilities. We got to have federal funding brought in. The other message, obviously, is control the opioids. We already know that I am told that 20 to 25% overproduction of medications by the pharmaceutical companies. That's an issue. Where does that 20, 25% overproduction go? I think we can probably guess where part of it might go. Obviously, the additions, the additives, whether they're home brewed or brought in from China, I don't know how you control that. But funding is the key, and federal funding isn't necessary. It's certainly necessary. You can talk all about the epidemic. But my question is, as having lost a daughter within the last 2 months, is I hear it spoke everywhere, epidemic at the federal level. Where's the funding? And that's what we need. We need funding. It's overwhelming the hospitals, too. I think of the number of times that my daughter was tying up the various hospitals as results of OD. She was a multiple ODer. And this only happened about the last year and a half. I never saw needles at Mark's or anything until last summer when she went up to Massachusetts and came back from there with her boyfriend. I never saw them before. As you all know, if anybody's worked with somebody that's on it, they're compulsive liars. They're very convincing. They can tell you the best tale and you'll believe it. You got to keep all money away from them. But they can always find the money. In my case, it was theft from the family to help fund part of it. But funding is the key, and maybe how do you work, and this gets into police matters, I don't know how you work across jurisdictional lines, Seminole County, Orange County, where you put them, these dealers have no lines. They love to, I found out they love to, they're young, some of them, they love to display their weapons. They're well armed. I had one go down right in front of my house. My daughter was not anywhere around about a year ago. The windows were dark tinted. I wasn't fixing to go out and get the license plate. I wanted to, but it wasn't worth it. These people are armed. They're fearless. And the money is so great, they're willing to take the chance.
Thank you.
Okay, with that, we'll give Mr. Secretary the last word. Thank you all for being here.
Thank you. That concludes the press conference. Thank you so much for everyone.